Ladies and gentlemen, dear colleagues, dear friends, I would like to give you a practical overview of the work the University of Hamburg is doing, but also it's a combined work of the German Association of Sports Medicine, which covers around 8,000 medical doctors. So we introduced a workplace health management plan, and our causal theory for the conception of this workplace health management program of the university clinics of Eppendorf, of Hamburg-Eppendorf, is as follows, because we can do this in several manners. So as you may know, we have a huge problem in terms of physical activity. So we were built to move as Neanderthals around 40 kilometers, and now in the modern computer-based world, it looks completely different, looks like this, and it's only 500 meters, which causes huge problems. So as you can see here, so until the beginning of last century, the human beings, they were very active, they had a slim body, muscular, and now it's basically already very average. If you have a belly, and if you don't have a belly, you are under average or different already. And then we also know that we get an adult onset diabetes already in childhood and adolescence and in the medical school. So we have to change the terminology. So I was learning there's childhood diabetes and adult onset diabetes, but this is now pretty wrong. So because children get already adult diabetes. So we have a big problem. And now the consequence and the combination of everything, of immobility and malnutrition. So we eat the wrong things and we eat too many things of this. And also our stress in modern life, too many influences, causes big problems, so that we get not just one disease, but we get even a combination of diseases. So we had to use a different terminology also. It's a syndrome, and the metabolic syndrome is one of the physical, of the movement deficiency diseases, as well as other diseases shown here. So the basis of everything is lifestyle, wrong lifestyle. It's physical inactivity, malnutrition, and this is our concept is based on this kinds of lifestyle which we offer to companies, and they use it on a regular basis. So we have sports, physical activity, nutrition, and also stress management in the system I would like to show you now for the workplace health management and fit at work. And this, our concept is based on 4 phases. So first we make a workplace assessment, then there is a need analysis. We would like to have behavioral prevention, and also we can evaluate if our program is working and show this to the companies. So basically the philosophy is the WHM, work-life balance through exercise, healthy lifestyle through behavioral prevention, and also, which is also important, motivation through target implementation. So how does now the health street work, which you can actually see here at the MEDICA, and we are doing this already for 5 years, but we are also using this very often with companies who ask our services, and actually not just from us, from the university clinics of Hamburg-Eppendorf, but also from other centers of the German Association of Sports Medicine. So we have around 25 centers at universities in Germany, and basically like between 10 are on a regular basis participating. So we have an easy traffic light system where you can see the results of the individual health check, and it's in green, yellow and red, so they can get easily an overview, and at the end we give some recommendation, and it's actually a modular system. So we have it's either more medically based, so it's internal medicine or orthopedic medicine, or it's based on function or fitness. So, and they can put together, the companies, or we can make recommendation of several stations, and each station takes 10 minutes. So they go from one station to the other, and if one goes from first station to second, the other person goes from the beginning to the first station, and so on. So we can cover actually 100 people a day to provide our services. And so we have around like 30 to 40 stations, and most companies decide on 5 or 6. So the whole program takes 1 hour. So at the end, there is always a final medical consultation for the employees and done by a medical doctor. So according to the outcome, they recommend solutions, and then the solutions will be most often carried out by either the company itself, by some physical activity programs, or by the so-called outside world, fitness studios and rehabilitation center and whatever. So and we also evaluate the data, and so we get some information for the company to change the whole system in a greater perspective. And the goal is, so we would like to sensitize, motivate, and take and recommend actions for the employee and in order to preserve one's own health. So now coming to how does the system look in details. So we start with a pre-consultation medical questionnaire, and you can use this as an app before you enter our health and fitness suite, which saves time. And this is based on lifestyle, the questions. So you can get lots of information just by this questionnaire: physical activity, nutrition, smoking, and stress. And then we ask about cardiovascular, metabolic risk factors, and then cardiovascular metabolic diseases, because this is basically the center of our system. And I think it's very important to do this within the company, because everybody or most people have to work. So it's the easiest way to make a necessary change to this pretty bad data of non-moving and of malnutrition. So then, because it's a modular system, so you can put many stations together. Here, I just show you a couple of examples what we offer. And the most important is each of these stations, they take 10 minutes or less, because one has to go from one station to the other, and you don't want to have a traffic jam. So, for example, there's also, for example, we're using often the heart rate variability, including the EKG, to see if the heart is working well, but also if they have any stress according to private or corporate life. And another measurement they often use are the risk factors for cardiovascular diseases. So we take cholesterol, glucose, blood pressure, etc. And from the orthopedic part, these are only some examples. So we can measure by using the MEDIMouse, a radiation-free study of the shape and mobility of the spine. So we can also see if everything is, because it's only a screening test, if everything is okay due to this test with the spine, and then we can perform further evaluation, because we have a whole medical clinic behind us. And here, for example, the pedobarography, we can use static and dynamic foot pressure measurements in order to see if there's any malpositions or pain or diseases which may translate towards the gait, but they are most often built up as the whole chain by muscle problems or by skeletal problems. And there's another example which we are using, because we also try to use dynamic tests. For example, the strength endurance test for the for the back muscles, and also the sit and so-called reach test, a method to see the flexibility of the spine, because the back problems are a quite common problem in the which are workplace related, and then you can take some actions. So after these modules, at the end, we will have a final medical consultation done by the medical doctor. So the medical doctor sees all the data. They see that, because most of the employees come on a yearly basis, on a half-yearly basis, they can see the progress and if anything changes, and if our recommendation work or not. And after this, so if everything works, so you have the result, and we also do intervention programs. This is very important. For example, they can be company-based, so the company has some solutions. They can be based on sports programs, fitness programs, but also they have often health insurances. Many of the big companies have their own health insurance. They can offer some nutritional consultation, whatever. And then we have non-company-based systems as well, if these are smaller companies or if they don't have this availability of company-based programs like fitness centers, rehabilitation, and sport clubs, etc. And if we, for example, because of the screening test, figure out that there are some major problems, or if we have to do a more detailed examination, and this is, for example, one we can use easily in sports medicine, the stress test or spiroergometry, then we perform this at a later date, or we offer also this for managers when they invest more time and more resources. For example, here then we can also give some exercise recommendations according to the lactate performance curve or to the spiroergometry curve, so which is then a more detailed evaluation at the end. So our German Association of Sports Medicine, we were also successful for some of the sports medical tests to have contracts with some health insurance companies, which may also cover some of the exams. So already we have with this 7 or 8 companies contracts, and actually the private companies in Germany, most of them are also paying for the sports medical exams. So it's very important that health and lifestyle, the health in companies, there should be a lifestyle change based on exercise, nutrition, and stress management. And as shown here, sometimes you have to be very tricky to make people who do not want to move, really to move. And I would like to say thank you very much for your attention.